All right, we all know that famous Christmas storyline. You'll shoot your eye out, but in all seriousness, many parents overlook eye safety when buying gifts for children. According to the Consumer Product Safety Commission, U.S. Emergency rooms treated close to 8,000 toy-related eye injuries last year alone. Dr. Kimberly Friedman is an optometrist, of course, with the New Jersey Society of Optometric Physicians. She joins us now to really talk to us and ensure that our holidays can be absolutely, positively safe. So that's exactly where we're going to start. We often take eye injuries or gifts that we're looking for. We don't really think about what eye injuries they could cause, but you do see an upsurge this time of year?
Right. We do see a little bit more in terms of eye injuries this time of year. In fact, there were over 8,000 last year seen in emergency rooms, and that doesn't even account for the ones that are seen in private doctor's offices like myself. And probably the most serious ones that we see are from the projectile toys.
Okay, what are some of the more dangerous toys that we should avoid?
Right. I think a lot of times it's common sense, but anything like darts, BB guns, paintball pellets, paintball guns, those are obviously the most serious. I think actually in my 15 years of practice, the worst eye injury I've ever seen was from a paintball gun. They had pellets like this. It was a 19-year-old gentleman who actually did get it for Christmas. He was showing it off to his friend in a garage. The trigger released. The paintball hit his eye. And he actually ultimately lost his vision completely in that eye from the injury.
Now, paintball, the darts, the bows and arrows, that kind of thing, are some things that kids really like, but you should say not buy them at all.
Either don't buy them, or if you're going to buy them, if it's an older child so that it's age appropriate, make sure you're using the appropriate safety goggles with them. Very often the toys will be packaged with the safety goggles, and if they aren't for some reason, you really need to buy them separately and ensure that the child's wearing them when they're using those types of toys.
Supervise is the key.
Absolutely.
What are the symptoms when it comes to eye injuries? How do we know that something, if our eye is red, that it could be more serious, like something to the cornea?
Right. It can really vary from something that's obviously very painful, red, irritating, and the corneal abrasions are probably the most common ones we see this time of year, and those people will have redness, irritation, tearing, blurred vision, and those are things that you really should call the eye doctor for right away and get seen.
That really kind of was my next question. If we say like a child or even somebody that we're sitting with and maybe isn't even our child, if they something's gone into their eye, when do we know that we need to seek the doctor?
Right. I would say if you're really not getting relief in symptoms within the first few minutes, you want to flush the eye out with some tears or some water, and if you're still not getting relief, you really need to get to the eye doctor. And that actually brings up a really good point, and that is that most people think to go to the emergency room, but the emergency rooms generally just patch the eye and tell you to go to your eye doctor. So it's better off to call the eye doctor first. They usually all have 24-hour emergency numbers, and it'll save you the time and money of 2 visits instead of 1.
All right, we're approaching the weekend, which is the busiest weekend of the year for the last-minute shopper. Give us some tips as to what we should look for when we're buying or choosing not to buy a toy.
Well, first, most importantly, make sure the toy is age appropriate. They all have age recommendations on there. You also want to look for any broken toys, any sharp or jagged edges, things like that. A lot of it's common sense, but sometimes we forget in the busyness of the year.
Okay, you know what, too, when it comes to tree ornaments, sometimes not even the ornaments first. Let's talk about the tree, because the kids can walk by the tree and the bristles will get them. That can actually cause an eye injury.
That one is probably the most common injury we see every time this year, and that is corneal abrasions from the branches of the trees. Whether it's from leaning in to turn on the tree, plug it in, to put in an ornament, or just carrying it in and setting it up. Very often we see those injuries from the corneal abrasion from the branch rubbing against the eye.
And then a glass ornament can break, and then it splinters, and something like that could get in the eye?
Absolutely.
Yeah, okay. We want to thank you, Dr. Friedman, so much for bringing all of this to us, because it really is important. We want our kids to be safe, particularly at the holiday time.
Right. Thank you very much for having me.
Happy holidays to you.
You too.
All right, and remember, too, she does visit us very often from the